Basically, this is part of the recent publication on the first 12 participants, and it's showing the setup, the design of the study. So it's a feasibility pilot trial, 12 patients already published, and we are now looking at a little bit bigger sample. It's treatment-resistant depression and moderate to severe depression, and people have been treated with at least 2 different classes of antidepressants without any effect on their depression in order to be qualified for inclusion in the study. We prepare people over some sessions, carefully screen in order to include the patients in the study. We do some imaging, not during the effect of the drug. All that was done in healthy, the work that have been done in our group previously. This was done before and after the treatment sessions in order not to interfere with the actual treatment. And then, of course, there's the sessions themselves. Mental, Kaylin also yesterday showed some nice photos of this room that we have tried to make less clinical and a little bit more like the Johns Hopkins group. They have been incredibly helpful all the way through setting up all these experiments, and we have tried to sort of suck out some of their experience. Of course, it's not a Bill Richard level when we sit and do our guiding, but still we do our best. So we have also created this sort of lovely, supportive, aesthetically nice environment. We have music playing, as Mendel was talking about yesterday, and then we are 2 psychiatrists present during the sessions, 6 hours around that. And then there's the integration, the follow-up, where we are discussing and trying to make sense together with the person or the person themselves, but we are sort of trying to facilitate some of that with them afterwards. This was also shown yesterday, so this is sort of the main thing. This is actually the outcome, the results on the depression. We are using a couple of different rating scales of depression. This is one of them where you can see most of them actually fulfill criteria for severe depression when they enter the study up in this area, and they drop significantly at the 1 week, the main outcome of the depressive symptoms, and a lot of them are staying down for quite a while, and only a few of them are after 6 months up in the severe area again. So it's not a magic cure. It doesn't mean that everyone will be completely cured for the depression, but a lot dips and stay down for a quite significant amount of time, and that is what we're interested in here, in trying to find out what is this about? I mean, this is not normal treatment of depression with SSRIs where you give for months and years every day. And this is a one significant, meaningful, profound experience in a supported environment that is initiating all this. And I want to show here one of the reports from one of the patients. The patient is a 52-year-old male, had for years and decades been battling depression, the awful feeling that you don't matter, you're not making a difference, that everyone else is having a better life, the utter pointlessness of it all, getting no real enjoyment from anything. That's how he was sort of putting words to his state before he entered the trial. And the actual experience during the session he described by saying that words can't describe the experience, but I can say that the usual negative self-narration that I have had vanished completely. It was replaced by a sense of beautiful chaos, a landscape of unimaginable color and beauty. I began to see that all of my concerns about daily living weren't relevant, that they were a result of a negative spiral. And afterwards, and this was actually also quoted yesterday by Robin, but you did not see that, so I wanted to put it in here. That although it's early days, the results are amazing. I feel more confident and calm than I have for such a long time. My outlook has changed significantly too, and I'm more aware that it's pointless to get wrapped up in endless negativity. I also feel I have seen a much clearer picture. Now I can enjoy things as I used to and feel a bit more. Before I suffered, I fell into the depression. So we are curious of what is all this about. But before going too much into the personality part, I'll start by showing the maturation of the brain in terms of the functional connections of the different brain areas. So not only functionally, but also anatomically, structurally, the brain matures to become more sophisticated, more refined in terms of the connections. So areas that are supposed to work together to solve different tasks and serve different functions, they become more clearly connected anatomically, but also functionally, and that we can show by doing brain imaging and do some fancy mathematics around it, and show that the different areas of the brain that are confined to different networks, they become more and more separated during development from childhood to adulthood, and the networks become more segregated. They're more separated from each other, and within the networks, the regions are working functionally more closely together. That is evolutionary and probably very important. It makes us being able to sort of have an order in the way we're thinking and be analytical. But it can also maybe be too much. It's shown in depression that if some of these areas that belong to a specific network, if they work too much in synchrony with each other, they are sort of over-connected, then that is related to some of the rigid thinking and rumination that we see in depression. So what about trying to sort of loosen that up? And that is what the psychedelics, our group and others have also shown, that some of this is broken down. Suddenly areas are starting communicating. It's possible to communicate across, a little bit like going backwards in terms to an earlier state where these networks were not as defined and separated exactly as in childhood. And this is not to say that this is what it looks like in childhood, because this is actually on psilocybin, but it's related to what's seen in childhood. And the childhood stage, and the reason why I don't know if anyone recognizes from the Lego movie, these two, the kid and his father, is a nice example of showing that the child has this playful, creative, flexible way of playing and of meeting and addressing the world. So the father in the Lego movie, he is like, he doesn't want a Lego man from Space Lego to be in the sort of Wild West Lego. That's confusing. They need to be separated. So he's basically gluing everything together in order. Now I'm spoiling the film. I'm sorry about that. But anyway, so he can't accept that sort of thing, that the different worlds are emerged into each other, and the son is making a resistance movement within all these Lego worlds, and basically he mixes the whole thing up, and it doesn't matter, they can play across. So that flexible, more creative, playful way of thinking is something that the child has within them. And until actually now, I have the Duplo thing, the massive Lego thing. That's the little sister who is even more flexible and bringing Duplo into it, and that is even too much for the kid, for the son. But and also, of course, to mention that the reason why I use this analogy is that we are using the song from the Lego movie through 6 hours. That would be. Imagine what that would do to the suicidality in that study. If everything, yeah. Anyway, okay. So in order to look at things that might give us a better idea of what's actually happening, we can look at measurements of personality, because some of those measurements actually are covering some domains that are a bit relevant to this more open thinking and open arms towards the world and other ideas. The NEO-PIR, or the Big Five, is an established model to look at depression. It's a 240-item questionnaire. It's covering 5 domains of 5 traits of personality: neuroticism, extroversion, openness, agreeableness, and conscientiousness. And they are each made out of 6 facets, and each facet is created out of 8 questions. So if you add that up, it becomes 240 questions. And one of them that have received particular interest within the field of psychedelics is the openness. And openness is a personality construct which covers aesthetic appreciation, sensitivity, imagination, fantasy, broad-minded tolerance to others' viewpoints and values. So it's an interesting component, an interesting domain of personality. And as beautifully shown by the Johns Hopkins group, Kathleen McLean published this finding that in psychedelic, naive, healthy people, the session with the psilocybin led to an increase in openness, and even more than a year later, it was still increased, in particular in people who had had a real mystical experience during the session. And in our own group, with a recent LSD trial, it was also shown that 2 weeks after the session with intravenous LSD, openness was also increased, and actually related to the sort of more disordered, chaotic state of the brain when you look at brain imaging. Also, some data from Copenhagen, where we looked with different sorts of PET imaging in recreational users of ecstasy and psychedelics. The only thing that was differing in all the domains between the three groups in terms of personality was that the psychedelic preferring users, they were having increased openness, and that was actually related to some serotonin transporter levels in the frontal cortex, but I won't go into that now. Interestingly, in depression, it has also been shown that some of these domains are changed. Some of these personality parameters are changed. Neuroticism is higher in people with depression, and openness and extroversion lower. And also within psychosis have been seen that these things are related to the mood states and similar directions of the differences. So another thing to look at is the relation between personality and some of the markers, the receptors we can measure in the brain. And interestingly, we showed in Copenhagen in 2 different samples that the 2A receptor is higher if people are high on neuroticism on that domain. So if people are neurotic, they seem to have higher 2A binding, maybe as a compensation of having of the 2A receptor not being stimulated that much with serotonin. So maybe it's a compensatory upregulation in these subjects. And also, it has also been related to pessimism. So neuroticism, pessimism seems to be related to high 2A. 2A, of course, is interesting because that is the target, that is what we agonize, we stimulate with the psychedelics. So in the trial, we had also 3 measurements at baseline and 1 week after the high session. Remember, there were 2 sessions, 10 milligram, and 1 week later, 25 milligram. 1 week after the 25 milligram, we had another assessment of personality using this instrument, and then also after 3 months. And then the question, of course, what did we actually then see? And that's because it would be interesting if we saw some of the same interesting stuff that has been seen in healthy, and we actually did. We did see the increase in openness in these patients, and we also interestingly saw a decrease in neuroticism and increases in extroversion and conscientiousness, and no change in agreeableness. Then the 3 months follow-up you have in blue here, and you can see that it's still more significant than at the baseline, but it's falling a bit back towards how it looked before the treatment, but still in the same direction. So neuroticism is still down and extroversion, openness up. Conscientiousness is no longer significant at 3 months, and agreeableness completely unchanged. Then I took from the NEO-PIR manual some normative data, so on healthy people as part of the construction of the whole instrument, and put that into the data set here. And you can see that basically we are moving all the parameters towards what is seen in a normative data set. So down towards the level of neuroticism and towards the level of extroversion. Openness, we are overshooting a little bit here, but that is also probably biased because people who are willing and interested in going into this kind of experiment at this stage, in this time of the research, will be more open. We have also shown that in other experiments that they differ a little bit for other volunteers, that people going into some of these experiments are more open already. Then within the facets, we looked at which ones were significant and actually surviving comparisons for multiple correction for multiple comparisons. So they are the ones that are marked in red, and also the ones that survived the same correction after 3 months are the ones that have blue stars. So warmth, positive emotions, openness to actions, and openness to values were significant after 3 months surviving the corrections. And here they are. I won't go into detail at all. Warmth is covering that people perceive themselves, describe themselves when they fill out the questionnaire as warm and friendly. They get pleasure out of chatting with people, outgoing, positive emotions. They can bubble with happiness, feel light-hearted, and often would use words as fantastic and sensational. Openness to values, meaning openness to other people's values, to different ideas, being broad-minded and tolerant of other people's lifestyle. Openness to action is basically not being stuck in ways to do things in a very strict way, that they are not willing to sort of change, being open to do things in a different way. Interestingly, it has been shown that in treatment of depression, SSRI treatment, when it works and people go down in depression and are basically being treated for their depression, then it has been shown that then that actually leads to decreases neuroticism and increase in extroversion, which is what we also just showed with the psilocybin. This is another example of it from another study, actually from the people who are behind the NEO-PIR instrument, and they showed that this is neuroticism and this is before treatment, this is after treatment. So neuroticism goes down and it's significant. I have the text about it here. And extroversion goes up, openness up, agreeableness nothing, and conscientiousness up. So basically this exact same pattern. When you look at the sizes of the movements, the changes on these parameters, it's a little bit difficult to directly compare with ours because these are T-scores, so it has been corrected in another way. However, we looked at the NEO-PIR manual and tried to compare at some data set where you have both, and they don't seem to differ more than between 1.5, 2.5, and we saw 30 changes, and where they saw 5 here. So that's 6 times, so at least around 3 times more pronounced than, again, it's a bit preliminary, but it looks like 3 times bigger changes in the NEO-PIR ratings that is seen in a study like this with successful treatment of depression with normal antidepressant treatment. And then, of course, it's one thing that's interesting to see, is there any relation, is the change in these domains, in these personality parameters, are they related to the beneficial effect we saw on the depressive symptoms? And they are. So both, the more you go down in neuroticism, the better effect on the depression. The more you go up on extroversion, up on openness, up on conscientiousness, the more you go down in your symptoms of depression when you rate that. Oh, sorry. And then another thing that I wanted to mention also, because Robbie didn't have time to put it in his talk, and we just looked at the data for the first time the other day, and I think in this meeting, even though it is sort of raw and preliminary, it's interesting to show here, because we have seen in different studies, mainly from Johns Hopkins, that the mystical experience the depth of that is related to the beneficial outcome in healthy to well-being, and in smokers to stop smoking, and so on. So there's something there about the quality of the experience during that session. So it would be nice to look at the same thing, but we only used the mystical experience questionnaire in the end of the trial for some reason. So the closest we get in this data set will be using this scale for altered state of consciousness, and look at dimensions on that scale that is at least overlapping with what is perceived as mystical experience, tapping into that domain at least. And when we did that, we see here, and this is not corrected for multiple comparisons, but it's still interesting to show you guys that the feeling of unity, the spiritual experience, the feeling of blissfulness, insightfulness, all seem to be correlated to the outcome in terms of the beneficial effect on depression 3 months at 3 months follow-up. And that is basically that. Thank you.
Yeah, thanks, David, for that nice presentation. So we are open for 2 questions.
Very nice presentation, David. I think you
go more near to the microphone.
I think you hinted to it, but if you correct your changes in personality for changes in depression scales, do you see any change between before and after, or is everything corrected then?
That's part of the reason why I said it was very preliminary. We haven't done that yet. However, we haven't, so I can't answer it. But I did look on some things that are not supposed to be related to depression, on some of the facets, and several of them they also change. So it must be beyond what is just about the depression. And there are quite a lot of sort of data on change in personalities related to changes in serotonergic transmission in general, and in those studies they also try to separate what is actually just an effect of the change in depression. And a lot of it seems to be beyond that, even with double-blinded SSRI treatments in healthy. It's beyond, not healthy because then it's not depression, but also in the trials, it seems to be beyond just change in depression.
Because you saw some interrelationship, so it's interesting to know. Okay.
Yeah, but we will definitely look at that. Thanks.
Hi. Very quick question. How do you deal with patients that have personality disorders? In other words, are they excluded? Is this an exclusion criteria when they have severe personality disorder?
Yes, you know what, that's a very good question. Yes, it is an exclusion criteria. However, there's a little bit of a dilemma, I think, in any study looking at treatment-resistant depression. Per definition, if your mood is changed in a very permanent way for decades, then you can start questioning if that's depression or if it's tapping into personality, I would say. So I think per definition it's very difficult to completely take out, but if obvious personality disorders were an exclusion criteria, yeah, for sure. Thanks.
Okay, so thank you again, David.